New revelations are emerging this morning about drugs discovered at the home of Prince at the time of his death in April. Now, reports by the Star Tribune in Minneapolis and the Associated Press say investigators found counterfeit pills containing powerful opioids. They were also reportedly mislabeled. Michelle Miller shows us how Prince might have been the victim of a growing epidemic. Michelle, good morning.
Good morning. Some of the counterfeit drugs reportedly contain fentanyl, an opioid considered 50 times more powerful than heroin. But officials tell the Associated Press those pills were falsely marked, raising the question, did Prince know what he was taking? Prince weighed just 112 pounds when he died from an overdose of the drug fentanyl. The medical examiner's report says the fatal dose was self-administered and his death was an accident. It's unclear how the 57-year-old singer obtained fentanyl. But according to the Star Tribune, investigators are leaning toward the theory that he took the pills, not knowing they contain the drug.
You can envision the case of Prince. He took what he thought was a lower dose of a narcotic, and it ended up being a significantly higher dose.
An official close to the investigation told the Associated Press some pills found in Prince's Paisley Park mansion were falsely labeled as Watson 385, indicating they contained hydrocodone and acetaminophen, which is the active ingredient in Tylenol. But at least one of those pills tested positive for fentanyl. The potent drug is responsible for a growing number of deaths in the United States.
The problem is fentanyl is much, much stronger than the Tylenol and the hydrocodone. I think we're seeing a new epidemic, and the epidemic is people taking narcotics. They're causing problems and significant numbers of overdose and deaths. And at the same time, a new epidemic, which is counterfeit pills. And so when the two of them collide, as in this case, it appears like that, there can be lethal consequences.
Well, Prince died just less than a week after he passed out on a plane, forcing an emergency landing. An official also told the Associated Press the star did not have fentanyl in his system in tests done prior to his death, which could suggest he was not a regular user of that drug before he actually took that fatal dose.
Boy, that's scary.
It's going to get very interesting, I think, as we start to get closer and closer to what caused his death.
And who may have given him those pills.
Exactly.
Yeah.
Exactly.
Counterfeit drugs, they are on the rise, so
Yes.
beware.
Thank you, Michelle.